Thank you very much for staying on the program. Now, public sector doctors are returning to work today after a 3-week strike which crippled healthcare delivery across the country. The Ghana Medical Association called off the strike last Friday in response to a directive from the National Labour Commission. After calling off the strike, the next step is for the doctors and government to get back to the negotiation table to hammer out a set of conditions of service. Employment and Labour Relations Minister Haruna Idrissa says the negotiations could start today.
I'm aware that negotiations have commenced. Smith Graham of the Fair Wages and Salary is a chairman of the PSGNC, and we are confident and hopeful that by 30th September we should be able to put a closure onto this matter. Let me assure the Ghanaian people that this administration, the President Mahama administration, will bequeath to all health workers a codified, signed conditions of service. What we need is for all of us to change our body language and posture in the spirit of give and take to be able to resolve many of those differences. And I'm sure through dialogue, through consultation and negotiations, we should be able to reach and build harmony on many of those issues. I have accordingly conveyed same to my colleague Atu Forson, Minister for Health, Secretary, for us to convene on Monday at 11 a.m. to continue the process of negotiations. And I was indicating that the Public Services Joint on Category 2 and 3 is already negotiating. Informed that either yesterday or day before they met, and we have given them deadlines and timelines to meet. Indeed, it's the expectation of government that this year, general negotiations on base pay, minimum wage, and others, we should be able to conclude by end of October, so that the Minister of Finance, as was noted by your panelists, will factor this into the 2016 budget statement and financial statement.
Well, now let's get over to around the country and do some checks on the situation. Francis Aban just returned from the Kolebu Teaching Hospital. Let's find out what he gathered at that hospital. What did you see?
Well, as of 8 a.m. this morning, the doctors had not returned. I did my checks at the polyclinic of Kolebu, also at the surgical medical emergency units of the hospital. The nurses had arrived, but the doctors were not at post. At the polyclinic, I asked the nurses, and they wouldn't tell me on record, but they told me that they've been waiting since about 7:30 when they would come check in, ask what cases are there, and then they'll move on. We didn't have any of that. I waited till about 8:30, no sign of the doctors, but they tell me that they've been told that we should expect them this morning or so. They're all hopeful. There are lots of patients at the units. Most of them I spoke to were telling me that they need to get care as soon as possible. They've been waiting for a long time. They can't afford to go pay a lot of money at private hospitals, and so they are relying on the NHIS cards to get the care they need at the hospital.
Now, did you get a sense that these doctors will actually be at post today?
Well, yes. On my way to Kolebu this morning, I called a number of them, and they told me that by 7:30 they should be in their offices and working. But again, you listen to the sentiments they have beyond just showing up for work, and they're saying that, look, we went on a strike for a reason, but it seems like we're going back without it. And I mean the documents that will spell out their conditions of service. And they're saying that in as much as we're going back because a decision has been taken to, we're not happy. So if a man who needs to go back to work after a strike tells you he's not happy, you can ask yourself questions about how it will pan out when he's working. Will he give up his best when he comes to work? These are questions that I asked, and they were not able to give me clear answers to.
Oh, very well. Now, I'm going to have you hold on. Erastus Asaridonko has joined us from the Ashanti region. Hello, Erastus.
Yeah.
Now, you've been to the Konfanochi Teaching Hospital. What did you observe there?
Well, as early as 5:30 in the morning, we had patients who had come to the specialist OPD waiting because they've heard on the radio that doctors will be coming around, and so they have come to wait to catch the doctors early. And when you go to the polyclinic area, the situation was the same there. Patients had queued up in the morning waiting for the doctors to arrive. At the Accident and Emergency Center, they started working yesterday, because some patients came in yesterday. They were admitted as early as 5:30 when I was there this morning. We had somebody with a gunshot wound being brought in there. He was trashed and admitted as well, and doctors were in there attending to him. So it was early today when the doctors started working.
I see. Now, what have some of the patients been telling you?
Well, they are glad that the doctors are in. Some of them are angry that they had to subject them to this treatment because, mind you, the Konfanochi Teaching Hospital is a referral point for several towns and villages, even some regions, coming all the way from the northern region as well. And so many of them had their cases, would have their cases reviewed, and they did not have the opportunity. Some slept at the specialist OPD hoping that doctors will come to them. Some had also gone back to their homes, waiting and even trying to take painkillers and stuff to reduce the pain till the doctors come in. So there are some who are not too happy with what happened, and they are not too happy with the doctors as well. Again, there are some who also bear with them that they had concerns, and so the government should have attended to them early.
Very well, Erastus, thank you very much for that report. Erastus Asaridonko joined us from the Konfanochi Teaching Hospital in the Ashanti region, and he tells us that the doctors are back to work. In fact, today they have attended to an accident victim. Francis Aban, who went to the Kolebu Teaching Hospital earlier today, is still here with me in the studio. But did hospital authority tell you when these doctors will show up at the hospital?
Well, they also got the same communication as we all did last Friday, that they would expect them by 8 a.m. this morning. In fact, just to be clear, at the surgical medical emergency unit, I saw the nurses prepare as of 7:30, the equipment, getting ready, cleaning up the place. In fact, there were 3 patients that came in this morning. The first one that came in at about 6:15, because I got there a bit early. The first case that came in at about 6:15 a.m. was turned away because there was no nurse at post at the time. So at about almost 7, the nurses started coming in, started preparing. 2 more cases came through, and they took them in. And they were being taken care of in terms of giving them first aid. But you know that for that unit, you need a doctor to take care of these patients. So they're waiting, still waiting to get them back in.
But it is difficult to tell why the doctors have been reported to work, and authorities, you don't know if authorities have got in touch with the doctors to find out why they haven't reported yet.
Well, for the information I got, some have told me that usually delays like this happen. When the strike happens, it will take a bit of time before all of them will come in. Maybe they'll be late by an hour or 2, but they will eventually show up.
I see. Well, thank you very much, Francis. Francis Aban has been sharing his observation when he visited the Kolebu Teaching Hospital earlier today. In fact, he came back from there some 20 minutes ago. And now we would go across other parts of the country and find out what's happening. That we've been to the Konfanochi Teaching Hospital, where Erastus Asaridonko, our correspondent on the ground, tells us that the doctors have indeed resumed work. It came as early as 5:30 this morning. Let's find out what the situation is in the Volta region. Ivy Setoji has joined us from there. Hello, Ivy. Hello, Ivy.
Hello.
What can you report from the Volta region?
Well, this morning I went to some hospitals. I started from the municipal hospital in Bo, and then to the regional hospital. And I realized that the doctors are working. I spoke with some patients who told me some of them have been on admission since last Friday. And since that time, the doctors attending to them up to now, they are still attending to them. I realized the OPDs at the various hospitals that I visited were full. The OPDs were full. And then patients are going about. Some were taking their drugs, going for their drugs. Some were in the consulting rooms, except that the doctors wouldn't talk to any journalists. I also checked at other hospitals, a phone call to other districts in the southern part of the Volta region. And what I was told was doctors are at post, they are working. Right now, everything is back to normal.
Well, Ivy, thank you very much for that report. Ivy Satoji joined us from the Volta region. We can now go back to the Kolebu Teaching Hospital and find out if the doctors have reported and have started attending to patients who have visited the facility. Matilda Fumaga is joining us from there. Hello, Matilda.
Hello, Kemini.
Have the doctors come back?
Yes, Kemini, I've seen a number of the doctors around. Earlier, they went to the wards to review patients who are already on admission, and they are back in the consulting rooms, and they are attending to the patients who have reported at the facility this morning, Kemini.
Now, earlier, there were reports that these doctors had not reported to work as late as 8:30 a.m. this morning. Do we know why it happened that way?
Yes, I was interacting with one of the doctors of record who tells me that when they report at 7 a.m., they don't just move into the ward. They have a meeting, a review meeting. After the meeting, that is when they go to the main wards to assess those already who are on admission. So after doing that, that is when you find them back in the consulting room. So as we speak now, a number of patients have queued going to the various consulting rooms to see the doctors. And I can tell you that the nurses are also on standby, receiving new cases that are coming in today. Currently at the Department of Surgery at the Kolebu Teaching Hospital. I've been to the child health, I've been to maternity. Well, last week there was posters all over that no emergency, no new cases and all that. But this morning, all those posters and tickets have been taken off, and the doctors are back at post and then seeing to all the cases.
Very well, we'll leave it here. Thank you very much, Matilda. Matilda Fumaga joined us from the Kolebu Teaching Hospital, where she reports that now the doctors have returned to their consulting rooms, and she said the doctors were explaining they were at post, but they were at a review meeting earlier in the day. There's more to come here on Joy News Desk. Please stay on.